Well, it's just like that, melts off. So I guess our mountains are, Snowy Range, I guess, is in really good shape. So not too much.
All right, good afternoon. We'll call this meeting of Labor, Health, Social Services meeting together to order. Today is the 12th of February. Just a little heads up, we'll have a meeting on Friday. We'll take up 2 bills. And then Monday, we do not have session. So of course, there'll be no meeting on Monday, and then we'll take up a bill on Wednesday, and we'll get those ordered out. And you'll have plenty of notice on those. We have 1 bill before us today, House Bill 82. It is the last remaining interim committee bill that came out of the 2024 interim work. You'll note that Senator Hutchings is excused. She is presenting a bill in another committee. I think she did leave an absentee vote as well. She hasn't, so all right, we won't worry about it. I think probably it's easiest. This was actually a bill that kind of Ken Clouston from the interim committee kind of shepherded through. It's really the work of a lot of collaboration with the folks in the room, but I'll just walk quickly through the bill. This bill is about credentialing of providers by insurers, if you will. In this bill, they're called health carriers. And it sets a timeline for when this credentialing needs to occur. So, excuse me, there's some new this is a new section of law. There's some definitions. Some of them refer back to current statute, and then you get to page 3, line 14, and you talk about this process. And there's a 7-day response time, just letting the provider know that the insurer or the carrier has received it. And then there's 30-day response time, line 4, page 4, about incomplete. And then the healthcare provider now has an obligation to get the completed application back to him within 30 days. That's on line 9. And ultimately, what I think the outset of the value of the bill is 60 days from an application to a determination of credentialing. That's on page 4, line 15. And then the rest of the bill is basically, rulemaking authority. There is some on page 5, line C, 4 through 13, talks about reimbursing. And so when somebody becomes credentialed and has a contract within the network, then they're going to be reimbursed for coverable healthcare services. So some rulemaking authority. We have, of course, the agency is here as well, I see, so they can speak to that. So if there's anything I can answer for the questions, the issue we're trying to solve, and I think you'll hear this, is it seems like there are times where it takes some period of time, more than 60 days, to get health providers credentialed to provide services. That's a significant issue for the employer, the healthcare, the hospital, or whatever it is, and certainly for the earning capacity of that new employee. So that's what we're trying to solve. Like I said, this was resolved by folks in the industries that worked together to get this done. So hopefully there's no surprises today. And we will continue sailing through. Notice this is still a white bill, meaning there's no changes made to the bill and the other body. So with that, maybe we'll start, if anybody would like to speak broadly to the bill, if not, we'll start with agencies, Department of Insurance. Hello, Jill, welcome. If you'll introduce yourself and any comments from the agency perspective on the bill.
Good afternoon. My name is Jill Reinking. I'm the Health Policy Analyst for the Department of Insurance. And I just want to say that we were part of the discussion through all of last summer regarding this bill. There is specific language, as was stated by the chairman on page 5, section 2, where the Department of Insurance will be tasked with the rules and application. I'll let you know I have reached out to the insurers at this point and have started working on that application, looking to get a universal form that they can all agree with so that we hopefully can expedite the process. That would be it for the Department of Insurance, if you have any questions.
Thank you, Jill. Questions? Senator Steinmetz, and then we'll go to Senator Scott. Senator Steinmetz.
Thank you, Mr. Chairman. And Jill, I being new to this committee, if this is a dumb question, I apologize, but why are dental and vision insurance exempted from this? I realize they're a little bit different, but a uniform application for credentialing, why would that be different?
Go ahead if you'd like to, and then some of the folks who want to present can as well, so.
I
please.
believe it had to do, I'm sorry.
Go ahead.
Chairman, Senator Steinmetz, I believe it had to do a lot with the information that was required for the dental and vision insurance as far as the uniform application, that it didn't apply necessarily. However, I would have one of the other individuals speak up to that from that.
Okay. We have another question for Joe, then we'll get to further testimony. Senator Scott, did you have a
Yeah,
question?
Mr. Chairman, my question, pretty simple. Page 5, line 17, there's an accept as provided by WS 2622-503 on the health carrier not being required to approve credentials. What does 2622-503 do?
Do you
Go ahead,
mind
Ms.
if I
Green.
grab my green book?
You're welcome to. And actually, you don't have to answer it immediately. We can get back to that
Okay.
as time goes on. Any other questions for the insurance commissioner? Or the insurance office? Senator Crum.
Mr. Chairman, on the bottom of page 4, starting on line 14, it talks about the 60-day window and about, then on 17, it says it can pause if the application is incomplete. My only question, and I may have missed it, is there a provision that they need to be notified in a certain time frame that the application is incomplete? Or can they do it on the 59th day and then pause things after it's been sitting there for 59 days?
I believe.
Go ahead, Jill.
I'm sorry, Chairman Barlow, Senator Crum. I believe in the earlier part of that section 2656-102, it discusses how many calendar days the healthcare carrier has to notify him if there is a problem with that application. And then, so they would be notified at that point what was needed to correct anything within that application. When the corrections are made, then that time period would start again.
So Senator Crum, it's on page 4, line 4, 30 days, incomplete. Application is incomplete within 30 days. That'd be the notice to the provider.
Thank you.
Further questions for the department? Further questions? All right, seeing none. Did you get to that yet? You're getting there?
I'm about to.
All right.
If you want to go on, I can pull that up.
Mr. Chairman, did you want me to answer the?
Just hold on a moment. We'll finish this, we'll get Jill out of the seat, and then other folks that want to testify, Mr. Bowler, whoever's going to testify, come on up and join the table, and when Jill departs, we'll go from there. Let's go ahead, let's just keep going. Go ahead and introduce yourself, provide testimony. You want to respond to that question, that's great. Taking another question, Mr. Bowler, you'll be next. Go ahead, sir.
Okay, Mr. Chairman, my name is Kerry Hall. I'm the President and CEO of Delta Dental of Wyoming. And to answer the question on the exclusion of dental and vision, our Delta Dental application is like 2.5 pages long, and it's double spaced. It could be 1 page. We kind of keep it as simple as possible. There are limited requirements of what we need for information. On the health side, it's like 13 to 18 pages long. And so rather than have them be confused about what to put on the application, we ask that dental and vision be excluded. Same thing with vision.
Okay, thank you. Other questions for Mr. Hall? Questions for Mr. Hall? All right, thank you very much. Jill, looks like you've got an
Chairman
answer.
Barlow, Senator Scott, 2622-503 deals specifically with any willing provider. So I believe if they meet the criteria established for the provider credentialing, and they are willing to abide by those contract issues, that it would then, they're saying that it would then, for the any willing provider, would apply.
Okay, thank you very much. Any other questions? Thank you, Joe, appreciate it. Anybody else wants to testify, come on up. Mr. Bowley, go ahead.
Thank you, Mr. Chairman. Committee members, Eric Boley with the Wyoming Hospital Association. And if it's all right, the three of us will kind of present together here.
Go ahead, introduce yourselves and go down the line.
Good afternoon, Chairman, members of the committee. Kelsey Prestisator with Blue Cross Blue Shield of Wyoming.
Kelsey with Blue Cross, thank you.
Mr. Chairman, members of the committee, Mike Mosier, Cigna, also speaking on behalf of participants in the coalition, Mountain Health Co-op, and the Pharmaceutical Care Management Association. And with your permission, Mr. Chairman, I'd like to keep this mic open because everybody's on the same coalition and we don't need to testify separately. We're just one big happy family, so.
I'm pleased that we're all happy.
Thank you, Chairman Barlow. Denise Burke, I represent CVS Caremark and Aetna.
Thank you, Ms. Burke. Not everybody has to come up if they don't want to, so.
Yeah. Everybody in the family.
This isn't awkward at all. Mr. Chairman, members of the committee, Sheila Bush with the Wyoming Medical Society, also a happy member of the coalition.
Everybody's happy.
Well,
Thank you,
Mr.
Ms.
Chairman,
Bush.
last time we were able to drag all of our chairs up, so we didn't have that luxury, so.
Yeah.
Mr. Bowley is our point man.
Mr. Bowley,
So,
please.
Mr. Chairman, thank you, and I appreciate you walking us through the bill. I think you did a good job of identifying the problem that we're trying to solve. And as you mentioned, we worked through this for a lot of hours together through the interim this last year. Had a lot of meetings together, also with Representative Clouston in attendance. And obviously, as we recruit new providers to the state, which is difficult at best, we want to get them to work as quickly as possible, give patients access to care, and get the providers working. There's a big investment that usually goes along with bringing those providers in, and to have them sitting for months before they can get their credentialing in place so they can start seeing patients. We identified this and came up with a solution. And so we're excited, one, for the fact that there will be one standardized application, and appreciate the Department of Insurance being so willing to help us with that. I would just, in context, give you a couple of examples. And part of the reason that we brought this is that we've seen good examples of how this is done around, not only within the state, but around the country. Medicaid is a great example. Medicaid can get the credentialing process done for providers in 7 days. Usually they can do it in less than that. We've seen it take up to 24 hours. Medicare can normally get it done in about 30 days. And when we brought this forward, we actually had seen situations where we had new providers in the state that some of them had been waiting 160 days to get their credentialing done. And so we work closely with other state associations, and New Mexico has a really good program. Their legislature passed legislation a couple of years ago, and I think it was 45 days that they had put in the statute, and in just their last session, they lowered that to 35 days. So we kind of feel like we came to a sweet spot with 60 days in working with our insurance companies. And I think your question, Senator Crum, was answered, but there is notice of when the application is received, and then there's also notice if there are missing components. But we believe that a lot of that will be eliminated by the one standardized form, because currently providers have to fill out a form for each insurance company. This one would just give us one standardized form with all the information necessary to be able to get those done. I think the other important thing here is if a new provider comes into the state, if they do their credentialing packet and they also contract with the insurance company, they can start seeing patients, and then they have the assurance because of that contract in place that they can be reimbursed for patients that they start seeing almost immediately. And I don't think I missed anything, but with that, I'd answer any questions.
Questions for the committee? Mr. Bowley, or any other group? Questions? All right, seeing none. Thank you. Nothing else to add for Blue Cross or for Cigna, et cetera? All right.
Mr. Chairman, I would just say how grateful I am for the work we were able to do again this session. It's great when we can get our partners together and come with a bill that we all feel good about. And I think there was give and take on both sides, and grateful for the partnership that we had. Thank you.
Thank you. Appreciate it. Excuse me. Further comments, further public, is anybody online? No one else in the room wants to comment on this bill? 2, 4, 6, 8, 10, 12, 13 people in the room, and we got, wow, this is pretty good. We'll see how that goes on Friday. All right, further discussion on the bill? Anything from the public? Nothing online? Public comment is closed. Which committee, what's your pleasure?
Move the bill.
Moved by Steinmetz. Thank you, Senator Steinmetz. Discussion on the bill? Discussion on the bill? No discussion, no amendments. Please call the roll on House Bill 82, Provider Enrollment Standards.
This is a roll call vote for House Bill 82. Senator Crum,
Aye.
Senator Hutchings, Senator Scott, Senator Steinmetz, Chairman Barlow. Mr. Chairman, that is 4 aye and 1 excused.
All right, perfect. Thank you very much. Unless somebody has a burning desire to take this bill, I'll be glad to finish up the committee bills on the floor. Nobody?
I have no burning desire.
No burning desires. Okay, I will take up this bill on the floor. Yep, thank you. And so as a heads up, we will take the two life-related bills, the regulation of I can't remember the name of it.
Yeah.
Can't remember the name.
Martha's bill, right?
It's Representative Lawley's bill and Speaker Nyman's bill on Friday. And then we'll probably take up my belief is we'll take up the bill on transparency, pricing transparency next Wednesday. So that'll give you the next 2 days of committee meetings. We do not have one on, we are done, so thank you. You were excused. Your work is complete.
You did? You didn't get it.
Oh, I did.
What was it in here?
Remember I said I was going to.
Oh, yeah, well, we do a written one, but I thought you were going to drop it off. No, it's okay. That's all right. She did tell me she was going to vote aye, but I thought we were going to have a form too, so my apologies. All right, so that kind of rounds out the next 3 meeting dates, and then we'll see what else the president sends our way. So with that, we are adjourned. Thank you very much. That's all right. It's excused. It's okay.